Greetings, I'm Dr. Karl Nath, the Editor-in-Chief of Mayo Clinic Proceedings, and I am pleased to welcome you to the multimedia summary for the journal's January 2026 issue. There are 3 articles that have been selected as our Editor's Choice or Highlights articles this month. The Editor's Choice this month is an original article entitled Association Between Mediterranean Lifestyle and Lower Risk of Chronic Kidney Disease, a population-based prospective study. It is authored by Dr. Hyo-Jung Kim from the Department of Internal Medicine at Yonsei University College of Medicine's Institute of Kidney Disease Research in Seoul, Republic of Korea, and colleagues from other institutions in South Korea. Chronic kidney disease can lead to hypertension, fluid and electrolyte disturbances, disorders of mineral metabolism, and uremic symptoms and complications. Chronic kidney disease tends to be progressive in nature and may culminate in end-stage kidney disease, the latter requiring replacement of kidney function. Chronic kidney disease is a major risk factor for cardiovascular disease, and indeed, the risk of dying from cardiovascular disease during chronic kidney disease is greater than the risk of developing end-stage kidney disease. Understanding what decreases the risk of chronic kidney disease is thus of considerable importance. To this end, Kim et al. Evaluated the association between a Mediterranean lifestyle and incident chronic kidney disease. The authors used the prospective UK biobank and included more than 150,000 individuals without chronic kidney disease who also completed relevant questionnaires. The Mediterranean Lifestyle MedLife assessment comprises 3 blocks that include Mediterranean food consumption, Mediterranean dietary habits, and a 3rd block encompassing physical activity, social habits, rest, and conviviality. Each block includes multiple items, all of which are independently scored. Scores ranging from 0 to 26 were then subdivided by Kim et al. Into quartiles. The higher the quartile, the more faithfully an individual followed a Mediterranean lifestyle. The data demonstrate that individuals who had a higher MedLife score exhibited low blood pressure, body mass index, and a lower prevalence of diabetes, hypertension, and cardiovascular disease during follow-up lasting more than 11 years. Chronic kidney disease occurred in 2.75% of these participants, and for each 1-point increase in the MedLife score, the adjusted hazard ratio for incident chronic kidney disease for quartiles 2, 3, and 4, compared with quartile 1, was 0.80, 0.76, and 0.65 respectively. In discussing their findings, the authors point out that a higher MedLife score is generally associated with less risk of the metabolic syndrome and type 2 diabetes, less inflammation, lower blood pressures, healthier lipid profiles, and decreased vascular complications. All these effects would decrease the risk of chronic kidney disease. Additionally, a Mediterranean lifestyle is associated with greater physical activity and a higher potassium intake, both of which confer cardiorenal protection. Other diverse benefits of MedLife include increased dietary fiber intake, improved sleep, and greater social engagement, all of which lessen the risk of cardiovascular disease and chronic kidney disease. The findings of Kim et al. Demonstrating the association of a Mediterranean lifestyle with a lower risk of chronic kidney disease is likely driven by multiple health-promoting effects of this lifestyle. It is this encompassing, holistic nature of a Mediterranean lifestyle that underlies its salutary effects in an increasing number of diseases, and, as shown by this important study of Kim et al., diseases that also include chronic kidney disease. Our first highlight this month is an original article entitled Cardiorespiratory Fitness and Colorectal Cancer Incidence in U.S. Veterans, a Cohort Study. It is authored by Dr. Amir Ali from the Veterans Affairs Medical Center in Washington, D.C., and colleagues from other universities and institutions in Washington, D.C., New Brunswick, New Jersey, New York, and New Orleans, Louisiana. In the United States, colorectal cancer is second only to lung cancer as the leading cause of cancer mortality. Ali et al. Questioned whether cardiorespiratory fitness associates with a lower risk of colorectal cancer. Their study utilized the Exercise Testing and Healthy Outcomes Study, ETHOS, based in the Veterans Affairs Medical Center in Washington, D.C. Cardiorespiratory fitness was determined by standardized exercise treadmill tests, and based on cardiorespiratory fitness, individuals were grouped into quartiles designated least fit, low fit, moderate fit, fit, and high fit. Over 10 years of follow-up in more than 650,000 individuals, colorectal cancer developed in 8,190 individuals. Compared with individuals in the least fit category, those in the low fit category had a 14% lower risk of cancer, with a progressive decline in cancer risk as fitness increased. In the high fit group, the risk of colorectal cancer was decreased by 57%. For each 1 MET increase in cardiorespiratory fitness, there was a 9% reduction in cancer risk. This inverse association occurred independent of sex, race, and relevant comorbidities. This study has multiple strengths, including the size of the cohort, the observed incidence of cancer, the fact that this is the largest study of this type involving women, African Americans, Hispanic, and Native Americans, and in this study, cardiorespiratory fitness was objectively measured by an exercise treadmill test. This study adds to the evidence that cardiorespiratory fitness is inversely associated with cancer risk, an effect possibly explained by the following salutary effects of cardiorespiratory fitness: improved endothelial health, decreased inflammation, improved immune surveillance, improved metabolic control, increased insulin sensitivity, decreased adiposity, a more favorable sex hormone profile, and lower levels of IGF-1. Importantly, as noted by Ali et al., the degree of cardiorespiratory fitness associated with a lower risk of cancer may be achieved by most middle-aged and older individuals. Finally, based on the present findings, it is possible that the concerning increasing incidence of colorectal cancer now observed in young and middle-aged adults may reflect, at least in part, in this age range, a more sedentary lifestyle and a low levels of cardiorespiratory fitness. Our second highlight this month is an original article entitled Cardiovascular Health and Outcomes in Carriers with Genetic Variants of Hypertrophic Cardiomyopathy. It is authored by Dr. Nirav Patel from the Division of Cardiovascular Disease at the University of Alabama at Birmingham, Alabama, and colleagues from hospitals and centers in Boston, Massachusetts, Minneapolis, Minnesota, and Birmingham, Alabama. Patel et al. Studied two groups, one comprising 446 individuals with pathogenic or likely pathogenic variants in hypertrophic cardiomyopathy, sarcomere-encoding genes. The other, a control group without these variants. Cardiovascular health was assessed by the Life's Essential 8 score that includes diet, physical activity, nicotine use, sleep, BMI, blood lipids, blood glucose, and blood pressure. Based on these scores, participants were categorized into favorable, intermediate, or unfavorable cardiovascular health. The primary outcome was a composite of heart failure, arrhythmias, and cardiovascular mortality. While overall cardiovascular health was not significantly different between the groups with or without these genetic variants, the group with genetic variants had a significantly increased risk of the primary outcome. In individuals without genetic variants, those with intermediate or unfavorable cardiovascular health scores were at a risk for the primary outcome when compared with those with a favorable cardiovascular health. Notably, for each category of cardiovascular health, in those without the genetic variants, the risk was significantly increased for the corresponding cardiovascular health category in those with genetic variants. Interestingly, for carriers of the genetic variants, the risk of the primary outcome was comparably increased, irrespective of the category of cardiovascular health. In discussing their findings, Patel et al. Emphasized a proactive approach for at least 3 reasons. First, early identification of these genetic variants may lead to earlier management that target cardiovascular health. Second, as the primary outcome was increased in those with genetic variants, irrespective of cardiovascular health, Patel et al. Raised the question whether the threshold for initiating management should be lower than in those without such variants. Third, as concepts regarding hypertrophic cardiomyopathy and its treatment are evolving, and as individuals with this condition face other medical conditions and significant challenges, these individuals should be managed by cardiovascular specialists as part of a multidisciplinary healthcare team. In summary, these 3 studies provide complementary findings. The study by Ali et al. Shows an impressive inverse relationship between cardiovascular fitness and colorectal cancer. Physical activity, however, is but one component of the array of potentially beneficial lifestyle effects. In this regard, Kim et al. Demonstrate that a Mediterranean lifestyle associates with a lower risk of chronic kidney disease, while a recent prior study in this journal demonstrated that a Mediterranean lifestyle is also inversely associated with all-cause and cause-specific mortality. Even for genetic diseases, lifestyle considerations, in particular, those that make up life's essential 8, as pointed out by Patel et al., may mitigate the adverse effects of hypertrophic cardiomyopathy attended by pathogenic or likely pathogenic genetic variants. Disease results from the integrated and net effects resulting from the interplay of the genome and the exposome. The former comes to us from birth and is largely unchangeable, whereas the exposome may be beneficially affected by recognized lifestyle components. Indeed, the recognition of the importance of lifestyle medicine has led to a discipline, a medical specialty, a college, and a journal, all coalescing around and dedicated to this field. Cognizance of the influence of lifestyle on health and how lifestyle may be beneficially altered is a fundamental issue, as the exposome has such broad-based and far-ranging effects that crucially determine our health and our risk for disease. You can access these highlights and editor's choice articles free of charge during the entire month of January. We invite you to visit our Mayo Clinic Proceedings website at www.mayoclinicproceedings.org, where you'll find our online-only features and many news stories posted in the News from the Editor carousel on our website homepage based on articles published in Mayo Clinic Proceedings. You will see other free content as well as articles published online in press. You'll also find access to our social media by clicking the links to follow us on YouTube, Facebook, and X under the media icons in the center of the homepage. On our YouTube channel, you'll find full-length author interviews called Insights and our MCP 60 seconds video article synopses. Please check out our Pioneers and Legends feature for interesting conversations with leaders in the field. Our homepage also includes a collection of articles that honor the past and look to the future in anticipation of our upcoming 2026 Centennial Celebration, and our Mayo Clinic Proceedings issue summary and author insight podcast recordings, which are also available through iTunes. As always, we greatly thank you for your interest in and your support of Mayo Clinic Proceedings. We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.